Hello all, hope everybody are doing fine. So from today we'll discuss regarding the national health programs in India. We're going to discuss national health programs in India. So in previous classes we have seen regarding the tuberculosis and ARI acute respiratory programs in India, and today we are going to discuss national malarial control program. We are going to discuss mainly on national malarial control program. So what is this national malarial control program? So in India, in the year 1950, this malaria, it was a major problem. It was a major health issue, and more number of mortality and morbidity deaths rate were occurred due to this disease malaria. So the Indian government has decided to launch a malarial control program. It has decided to launch a malarial control program, and it had launched the National Malarial Control Program in the year 1953. In the year 1953, the main strategy was to reduce the incidence of malaria in the country. And so the initial success against the disease, means the initial success of this program, National Malaria Control Program, was spectacular. It was spectacular, and they have seen a great success. So in the year 1952, there were about 75 million cases. There were about 75 million cases. You can see here in the year 1952, there were about 75 million cases. So the incidence of this malaria after launching the program, National Malaria Eradication Program, in the year 1953, so by the year 1958, there were only 2 million cases. There were only 2 million cases. This was the success rate for the program of this National Malaria Control Program. Coming to the components of the program. So these were some project components. So what are the project components in this program? Means early diagnosis and prompt treatment. Early diagnosis and prompt treatment. So what they are saying, they want to find out the case and they want to diagnose the case as early as possible, and they want to start the treatment for the disease. And next one is selective vector control. They want to find out the organism which is causing this disease, which is responsible for the disease, and they want to control the organism. So mainly by controlling the mosquito growth, we are able to decrease the incidence rate of malaria. And the next one is innovative eco-friendly methods. So they have introduced some innovative eco-friendly methods such as medicated mosquito nets, which is also known as MMNS, and the other one is larvarious fishes, and the other one is biolarvicides, and etc. These were some eco-friendly methods which were used in the control program of malaria. Next one is pandemic planning and rapid responses, including intersectoral coordination. So they have planned a pandemic planning. So if there is a sudden rise in the disease, and number of cases were increasing, they have planned to respond. They have created some hospitals, they have created the equipment, and they have created the health personnel to participate in such a situation, such a pandemic situation. Next one is institutional and human resource development. So they, as I said, they have developed the infrastructure, they have developed the human resourcement through training as well as reorientation training and intersector coordination, and strengthening management information system. And they have strengthened the information system so that every modality, every new treatment modality, every information is passed from one health personnel to another health personnel. And information, education and communication. So with proper information, the staff can be trained. With proper information and proper education, the health personnel who are working for this disease can be trained, and they can give a quality care during the crisis time. And second one is operational research. So through proper operational research, so through research work, they have created lot of modalities, and they have achieved a great success in the control of malaria. So this is regarding National Control Program, and we are going to discuss now regarding National Malarial Eradication Program. Coming to National Malaria Eradication Program. So this program was launched in the year 1958. This was launched in the year 1958. Initially, they have launched a program which is known as National Malarial Control Program. It was launched in the year 1952. It was launched in the year 1952 to 1953. It was mainly launched as a target to reduce the number of malarial cases. Why? Because in 1953 there were nearly about 72 million cases. There were nearly about 72 million cases. So as a result of that, the government of India has thought and they have launched a program which is known as National Malarial Control Program, NMCP. NMCP. This NMCP was converted into NMEP, National Malarial Eradication Program, in the year 1958. So the initial success against malaria by National Malarial Control Program had been commendable and the incidence of malaria had brought down. So encouraged by the results and they have got a fear so that the insect vector, it might develop resistance to insecticides as the insect vector is continuously exposed to insecticides. It was continuously exposed to insecticides. So there is a chance of developing resistance. So the health personnel, the program managers who were involved in this national control program, malarial control program, they thought that it might develop the resistance. Once the resistance is developed, and it will be very hard to control the disease again, and the incidence rate and prevalence rate will automatically increase. So in order to prevent those, they have changed their strategies and they have changed the name. They have converted malarial control program to National Malarial Eradication Program. They have converted to National Malarial Eradication Program. So this program, Malarial Eradication Program, it was reviewed in the year 1968. It was reviewed in the year 1968. So when they have reviewed, they have found out that the state Kerala, it had achieved complete eradication of the disease in the year 1965 to 1966. So what they have identified? The state Kerala, it had achieved complete eradication of the disease malaria in the year 1965 to 1966. In 1976, again in 1976, the incidence of malaria had increased. Year 1968, in the year 1968, the program was reviewed. This program, National Malarial Eradication Program, it was reviewed. When they have reviewed the program, they have find out that from the year 1965 to 1966, there were no recorded cases of malaria in the state. So the Kerala, it had achieved complete eradication of the disease from 1965 to 1966. Again in the year 1976, the incidence of malaria had again raised. So what is the first time incidence? In 1952, when National Malarial Control Program was, the cases were about 75 million. When they have reviewed in the year 1958, the cases were only 2 million. So again in the year 1976, there were approximately 6.4 million cases. And deaths were about 59 deaths were there. So in order to tackle this situation, the government of India, it had reviewed the situation and it had kept an expert committee. They have revised the strategy. Now we'll see what are the new strategies that were adapted by the government of India to control the disease malaria. The new strategies which were recommended by the expert committee. The first one is active surveillance for early detection of cases with fever and prompt treatment to them using chloroquine. So what they are suggesting, they want an active surveillance. For the detection of the cases. The people who are suffering with fever they want to start the treatment immediately using anti-malarial drug, which is known as chloroquine. Using anti-malarial drug chloroquine. The second one is to use anti-larval measures. They want to use anti-larval measures so that the mosquito is destroyed when it is in its larval form only. Spraying of insecticides other than DDT. So when DDT has shown resistance to mosquito vectors. And the third point is provision of mobile teams with health inspectors and 2 spraying squads with necessary equipment. It was recommended that 1 mobile team for every 10 PHCs in hypoendemic areas and for every 5 PHCs in hyperendemic areas, and the health education and community participation. And coming to the point, third point, what they are saying, they want to keep some mobile teams which were consisting of health inspectors and 2 spraying squads. They were what these people are doing, these people are going to every PHC. If it is a non-endemic area, if the incidence rate is little low in a area, then one mobile team is recommended for 10 PHCs. If it is having more number of cases, if more number of cases are present in a particular area, every 5 PHCs, they have recommended a mobile team. And the fourth point they are saying is health education and community participation. These were some new strategies which were recommended by the expert committee. So coming to the implementation strategies, So they want to implement this by following strategies: by government efforts, people participation, research, training and publicity. So coming to the government efforts, for effective control of malaria in the country, all the areas with API2 and above are being covered under regular spray with appropriate type of insecticides, along with fortnightly active surveillance for the case detection and treatment. Government efforts for the effective control of malaria, they have selected the places according to their surveillance, according to the incidence of the malarial disease. So all the areas with API2 and above are being covered by regular spray with appropriate type of insecticide. So wherever they find out that the cases of malaria are in the increasing state, the incidence is increased, there they are doing the appropriate regular spray with the appropriate insecticides. Areas with less than API2 are only having fortnightly active surveillance for case detection and treatment, but no regular insecticidal spray. So what this statement is saying, what the government is doing here, wherever they are finding out more number of cases, they are keeping an active surveillance there. What they are keeping? They are keeping an active surveillance, and they are regularly spraying the insecticides. And in the non-surveillance areas, such as where the incidence rate of the malarial disease is low, there they are not spraying regularly, but they are doing an active surveillance. If they find out any case, if they find out any suspect, immediately they are acting to it accordingly. And the next one is people participation. So without proper people participation, we cannot control the disease malaria in India. Why? Because it is a vast country with huge number of population. So if people are not obeying the government laws, if people are not following the proper sanitation techniques, we cannot control the disease malaria. So these people need to have an effective participation so that the disease is controlled in a good manner. The drug distribution centers and fever treatment reports are manned by the voluntary workers. What they are saying, the drug distribution centers and fever treatment reports, these are manned by the voluntary workers from the community. So what these volunteers has to do, these people has to create an awareness regarding the malarial problem among the people, and the members from panchayat and the public representatives, these people also must come and educate the people, because these people are the most influential people in a local place. They are being imparted orientation training about the occurrence, prevention and treatment of malaria at the PHC level, and these people should have knowledge regarding the volunteers should have knowledge regarding the occurrence, prevention and treatment part of malaria at the PHC level. And the other one is research. Research activities have been undertaken with financial assistance from the World Health Organization. So this World Health Organization is helping us for the research work regarding the malarial control and eradication program. Coming to the training part, the training facilities and programs are being strengthened, and these are getting strengthened to meet the needs of the training staff. So more the facilities and more the programs, the health personnel who are getting trained, they are showing more interest and they are gaining more knowledge so that they can act accordingly to the situation when they face the exact problem. And coming to the publicity, so this publicity is creating more awareness in the general public. A film was made which is titled as Eminence. It has been produced and it was presently being screened. It was being screened through the field of publicity units, mainly in the movie theaters and other publicity units. So, and by these programs, what they are doing, they are creating an awareness. They are creating an awareness in the public and as well as in the society. And the next one is international assistance. So the international assistance is taken in the form of technical guidance and drugs, insecticides, equipment and other research work. And moreover, they are conducting anti-malarial coordination conferences. They are conducting anti-malaria coordination conferences. These were conducted mainly to share the information regarding the disease, and to share the research work and to share the treatment modality. Example for this conference is, it was held in the year 18th to 19th August in the year 1983. Where it was held means it was held at the Trivandrum, and it was mainly in between the countries India, Sri Lanka and Maldives. And this is regarding National Control Program of Malaria and Eradication Program of Malaria. If you have any doubts regarding this topic, you can contact me through my email and through my WhatsApp. Thank you. Thanks for listening and watching. Please like, share and subscribe.